Advances in medical science and an enthusiastic public are making non-surgical procedures more common and more effective. Surgery to cure medical issues, improve quality of life, or eliminate pain, but it's no longer the only way to go. Joining me today, Dr. John Baker, an orthopedic surgeon specializing in sports medicine, shoulder and knee injuries, and total joint replacement. He's also a huge proponent of non-surgical therapies for pain management. Welcome, doctor.
Thanks, Olga. Good to be here.
Thanks for being here. Before we talk about this great stuff, I do want to share a little bit of personal history to our viewers about you, which it just fills my heart to say this, but you served our country, do appreciate military service, U.S. Navy?
United States Navy,
Oh,
yes.
that's fantastic. Tell us a little about it.
So I was enlisted, and I was also an officer in the military. So I've been on both sides, and I was in during the time that we had a lot of conflict going on. So I was there to serve, and I got to take care of the people coming back from Afghanistan and everything, and we did a great job.
Oh,
good time.
Thank you so much for your service. We do appreciate it. Okay, so your offices, I read here, are located in South Florida. Obviously, you're an orthopedic surgeon, and you do surgery when it comes to people getting injured. I love how you're a proponent of non-surgical treatments, and there's something kind of new, not so new, but really getting a lot of awareness now. It's called plasma-rich platelets. It's actually right behind us right now, PRP. Tell us a little bit about it and why you like it.
So platelet-rich plasma is a very good alternative for our patients. They can come in and get that done in the office. We draw their blood there. It takes about 45 minutes for them to get the whole procedure done. We'll draw their blood, we'll spin it down in a centrifuge, and once we get that blood spun down, it's like a platelet-rich plasma.
So you separate the blood?
We separate the blood, and we take the platelet-rich blood,
okay,
and then we'll do it under sterile conditions. We'll inject that into an area where they have pains. For example, the knee, elbow, shoulder. They're using it for cosmetics also. They'll do it for facials and hair loss. So it's got a lot of opportunities and a lot of things that we were able to do with that.
Because when I think of injections, and even my stepfather who gets, I think, quarterly injections of steroid, that's really the way to go sometimes, where people say, I need my steroid injection. How is this different, and why is it better?
It's better because steroids cause side effects. That bumps your diabetes, bumps your sugars, can affect you with that. It's your own blood. So we're drawing your own blood and we're giving it back to you to allow that to heal. So we're taking that platelet-rich plasma and we're putting it in an area which will help you heal with that. And it's used for a lot of different areas, and so you can use that to help with sports injuries.
So you can use it for like the elbow, the knee, shoulder?
Yes.
And all that pain will be better within how many days?
Usually it takes about 4 to 6 weeks for it to really heal, but about 24 to 48 hours, we ask you to take it easy afterwards. And then normally what it would be is you're going to see some good relief from it within a week. Fantastic. Sometimes it takes 3 injections, but we'll know more about that. But you can use it for tendinitis, like the elbow, like you said. You can use it for meniscus, like the shock absorbing your knee. You can use it for rotator cuff tears in your shoulder. Great. So there's a lot of areas.
I know you work with a lot of athletes, both amateur and pro, so this is actually a good option for them too, to get back on the field or just back on track? Very
good option for them. You'll see athletes going, before this was really popular, they would go overseas and get it done. Kobe Bryant, for example, went over to Germany to get it done. So some of the athletes have had PRP and they didn't have to have surgery. So it's a very good option for them to get them back on the field immediately and try to get them back to playing. And I've used it with my athletes. I do take care of some people from FAU, and I have a couple high schools I also take care of. And I've also taken care of some pros.
Talking more about pain management, doctor, your thoughts on medical marijuana?
So I'm a big proponent of medical marijuana. I'm one of the prescribers in the state here in Florida.
Okay.
I've been doing it for a while now. It's very good for a lot of different things, and it helps patients that have post-traumatic stress disorder, HIV, cancer, a lot of different areas where it can help the patient get better with what they're doing, and it's a big proponent of it for the narcotics. Obviously, in this state, we've had a big problem with pain meds and narcotics and opioids. I have a lot of my patients that were on those, and they're no longer on them.
That's
so
fantastic.
I'm very good. And the marijuana has a couple strains, one in the daytime, one at night usually. And the way we dispense that is you just come in for a consultation. We'll get you in, and we can give you a consult. And if you qualify for it, the state will get it to you.
I do appreciate it very much. I appreciate your time, and again, thank you for your service.
Thank you.
And if you'd like more information, valuable information, if you by chance live in Miami, Broward, or Palm Beach counties, and you need more info, and you're seeking the kind of therapies Dr. Baker offers, we encourage you to visit allegianceorthopedics.com. That's allegianceorthopedics.com, or just check out our website, thebalancing act.com.